246 Aphorism Organon of Medicine. On the other hand, the slowly progressive amelioration consequent on a very minute dose, whose selection has been accurately homeopathic when it has met with no hindrance to the duration of its action, sometimes accomplishes all the good the remedy in question is capable from its nature of performing in a given case in periods of 40, 50, or 100 days. This is, however, but rarely the case, and besides, it must be a matter of great importance to the physician as well as to the patient that were it possible, this period should be diminished to one half, one quarter, and even still less, so that a much more rapid cure might be obtained. And this may be very happily effected, as recent and often repeated observation have shown, under three conditions. Firstly, if the medicine selected with the utmost care was perfectly homeopathic. Secondly, if it was given in the minutest dose so as to produce the least possible excitation of the vital force and yet sufficient to effect the necessary change in it. And thirdly, if this minutest yet powerful dose of the best selected homeopathic medicine be repeated at suitable intervals, which experience shall have pronounced to be the best adapted for accelerating the cure to the utmost extent, yet without the vital force which it is sought to influence to the production of a similar medicinal disease, being able to feel itself excited and roused to adverse reaction. Footnote: in the former editions of the Organon one, I have advised that a single dose of a well-selected homeopathic medicine should always be allowed first fully to expend its action before a new medicine is given or the same one repeated, a doctrine which was the result of the positive experience that neither by a larger dose of the remedy, which may have been well chosen, as has been again recently proposed, but which would be very like a retrograde movement, nor what amounts to the same thing by several small doses of it given in quick succession, can the greatest possible good be effected in the treatment of diseases, more especially of chronic ones, and the reason of this is that by such a procedure the vital force does not quietly adapt itself to the transition from the natural disease to the similar medicinal disease, but is usually so violently excited and disturbed by a larger dose or by smaller doses of even a homeopathically chosen remedy given rapidly one after the other, that in most cases its reaction will be annoyed by salutary and will do more harm than good. As long as no more efficacious mode of proceedings than that then taught by me was discovered, the safe philanthropic maxim rendered it imperative for the homeopathic practitioner, for whom the weal of his fellow creatures was the highest object, to allow as a general rule in diseases but a single dose at a time, and that the very smallest of the carefully selected remedy to act upon the patient, and moreover to exhaust its action, the very smallest, I repeat, for it holds good and will continue to hold good as a homeopathic therapeutic maxim, not to be refuted by any experience in the world, that the best dose of the properly selected remedy is always the very smallest one, in one of the high potencies as well for chronic as for acute disease, a truth that is the inestimable property of pure homeopathy, and which, as long as allopathy and the new mongrel sect, whose treatment is a mixture of allopathic and homeopathic processes, is not much better, continues to renew like a cancer at the life of sick human beings and to ruin them by large and even large doses of drugs, will keep pure homeopathy separated from these spurious arts as by an impossible gulf. On the other hand, however, practice shows us that though a single one of these small doses may suffice to accomplish almost all that it was possible for this medicine to do under the circumstances, in some and especially in slight cases of disease, particularly in those of young children and very delicate and excitable adults, yet that in many, indeed in most cases, not only of very chronic diseases that have already made great progress and have frequently been aggravated by a previous employment of inappropriate medicines, but also of serious acute diseases, one such smallest dose of medicine in a highly potentized dynamization is evidently insufficient to effect all the curative action that might be expected from that medicine, for it may unquestionably be requisite to administer several of them in order that the vital force may be pathogenetically altered by them to such a degree and its salutary reaction stimulated to such a height as to enable it to completely extinguish by its reaction the whole of the portion of the original disease, that it lay in the power of the well selected homeopathic remedy to eradicate. The best chosen medicine in such a small dose, given but once, might certainly be of some service, but would not be nearly sufficient. But the careful homeopathic physician would not venture soon to repeat the same dose of the same remedy again and again, as from such a practice he has frequently experienced no advantage, but most frequently, on close observation, decided disadvantage. He generally witnessed aggravation for even the smallest dose of the most suitable remedy, which he had given one day, when repeated the next day and the next. Now, in cases where he was convinced of the correctness of his choice of the homeopathic medicine, in order to obtain more benefit for the patient than he was able to get until now from prescribing a single small dose, the idea often naturally struck him to increase the dose, since for the reasons given above, one single dose only should be given, and for instance, in place of giving a single very minute globule moistened with the medicine in the highest dynamization, to administer 6, 7, or 8 of them at once, and even a half or a whole drop. But the result was almost always less favorable than it should have been. It was often actually unfavorable, often even very bad, an injury that, in a patient so treated, it is difficult to repair. The difficulty in this case is not solved by giving instead lower dynamizations of the remedy in a large dose, thus increasing the strength of a single doses for the homeopathic medicine with the view of affecting the degree of pathogenetic excitation of the vital force necessary to produce satisfactory salutary reaction, fails altogether, as experience teaches, to accomplish the desired object. This vital force is thereby too violently and too suddenly assailed and excited to allow it time to exercise a gradual equable salutary reaction to adapt itself to the modification effected in it. Hence, it strives to repel, as if it were an enemy, the medicine, attacking it in excessive force by means of vomiting, diarrhea, fever, perspiration, and so forth, and thus, in a great measure, It diverts and renders worthless the aim of the incautious physician. Little or no good towards curing the disease will be thereby accomplished. On the contrary, the patient will be thereby perceptibly weakened, and for a long time the administration of even the smallest dose of the same remedy must not be thought of it if we would not wish it to injure the patient. But it happens, moreover, that a number of the smallest doses given for the same object in quick succession accumulate in the organism into a kind of excessively large dose, with a few rare cases excepted similar bad results. In this case, the vital force not being able to recover itself between every dose, though it be but small, becomes oppressed and overwhelmed, and thus being incapable of reacting in a salutary manner, it is necessitated passively to allow involuntary the continuance of the overstrong medicinal disease that has thus been forced upon it, just in the same manner as we may every day observe from the allopathic abuse of large cumulative doses of one and the same medicine to the lasting injury of the patient. Now, therefore, in order, while avoiding the erroneous method I have here pointed out to attain the desired object more certainly than until now, and to administer the medicine selected in such a manner that it must exercise all its efficacy without injury to the patient, that it may effect all the good it is capable of performing in a given case of disease, I have latterly adopted a peculiar method. I perceive that in order to discover this true middle path, we must be guided as well as by the nature of the different medicinal substances, as also by the corporeal constitution of the patient and the magnitude of his disease, so that, to give an example from the use of sulfur in chronic psoriatic diseases, the smallest dose of it, tincture sulfur X, can seldom be repeated with advantage, even in robust patients and in fully developed psora oftener than every 7 days, a period of time which must be proportionally lengthened when we have to treat weaker and more excitable patients of this kind. In such cases, we would do well to give such a dose only every 9, 12, or 14 days and continue to repeat the medicine until it ceases to be of service. We thus find, to abide by the instance of Salva, that in sporic diseases, seldom fewer than 4, often, however, 6, 8, and even 10 such doses, tincture sulfur X, are required to be successively administered at these intervals for the complete annihilation of the whole portion of the chronic disease that is eradicable by sulfur, provided always there had been no previous allopathic abuse of sulfur in the case. Thus, even a primary scabious eruption of recent origin, though it may have spread all over the body, may be perfectly cured in persons who are not too weakly by a dose of tincture sulfur X degree given every 7 days in the course of from 10 to 12 weeks, accordingly, with 10 or 12 such globules, so that it will seldom be necessary to aid the cure with a few doses of carboveg X degree, also given at the rate of 1 dose per week, without the slightest external treatment, besides frequent changes of linen and good regimen. When, for other serious chronic diseases also, we may consider it required, as far as we can calculate, to give 8, 9, or 10 doses of tincture sulfur at X degree, it is yet more advantageous in such cases, instead of giving them in uninterrupted succession, to interpose after every or every second or third dose a dose of another medicine, which in this case is next in point of homeopathic suitableness to sulfur, usually hypersulfur, and to allow this likewise to act for 8, 9, 12, or 14 days before again commencing a course of 3 doses of sulfur. But it not infrequently happens that the vital force refuses to permit several doses of sulfur, even though they may be essential for the cure of the chronic malady and are given at the intervals mentioned above to act quietly on itself. This refusal it reveals by some, though moderate, sulfur symptoms which it allows to appear in the patient during the treatment. In such cases, it is sometimes advisable to administer a small doses of Nux vomica X degree, allowing it to act for 8 or 10 days in order to dispose the system again to allow succeeding doses of the sulfur to act quietly and effectually upon it. In those cases for which it is adapted, pulsatilla X is preferable. But the vital force shows the greatest resistance to the salutary action upon itself of the strongly indicated sulfur and even exhibits manifest aggravation of the chronic disease. Though the sulfur be given in the very smallest dose, though only a globule of the size of a mustard seed moistened with tincture sulfur X be smelt, if the sulfur have formerly, it may be years since, been improperly given allopathically in large dose, this is one lamentable circumstance that renders the best medical treatment of chronic diseases almost impossible among the many that the ordinary bungling treatment of chronic disease by the old school would leave us nothing to do but to deplore were there not some mode of getting over the difficulty. In such cases, we have only to let the patient smell a single time strongly at a globule the size of a mustard seed moistened with mercur metal X and allow this olfaction to act for about 9 days in order to make the vital force again disposed to permit the sulfur, at least the olfaction of tincture sulfur X, to exercise a beneficial influence on itself, a discovery for which we are indebted to Dr. Kreislich of Karlsruhe. Aphorism 246 is rewritten in the 6th edition as follows. Every perceptibly progressive and strikingly increasing amelioration during treatment is a condition which, as long as it lasts, completely precludes every repetition of the administration of any medicine whatsoever, because all the good the medicine taken continues to effect is now hastening towards its completion. This is not infrequently the case in acute diseases, but in more chronic diseases, on the other hand, a single dose of an appropriately selected homeopathic remedy will at times complete even with but slowly progressive improvement and give the help which such a remedy in such a case can accomplish naturally within 40, 50, 60, 100 days. This is, however, but rarely the case, and besides, it must be a matter of great importance to the physician as well as to the patient that, were it possible, this period should be diminished to one half, one quarter, and even still less, so that a much more rapid cure might be obtained. And this may be very happily effected, as recent and often repeated observations have taught me under the following conditions. Firstly, if the medicine selected with the utmost care was perfectly homeopathic. Secondly, if it is highly potentized, dissolved in water, and given in proper small dose that experience has taught as the most suitable in definite intervals for the quickest accomplishment of the cure, but with the precaution that the degree of every dose deviates somewhat from the preceding and following, in order that the vital principle which is to be altered to a similar medicinal disease be not aroused to untoward reactions and revolt, as is always the case with unmodified and specially rapidly repeated doses. Footnote: What I said in the fifth edition of the Organon in a long note to this paragraph in order to prevent these undesirable reactions of the vital energy was all that the experience I then had justified. But during the last 4 or 5 years, however, all these difficulties are wholly solved by my new altered but perfected method. The same carefully selected medicine may now be given daily and for months, if necessary, in this way, namely, after the lower degree of potency has been used for 1 or 2 weeks in the treatment of chronic disease. Advance is made in the same way to higher degrees, beginning according to the new dynamization method taught herewith with the use of the lowest degrees of the other antisoric remedies except perhaps phosphorus X. It is necessary to administer few doses at similar intervals of sepia and silencia at longer intervals without any intermediate remedy where they are homeopathically indicated. Hypersulfur X can rarely be taken or smelt at shorter intervals than every 14 or 15 days. Before making such a repetition of the dose, the physician must, of course, be convinced that his selection is truly homeopathic. In acute diseases, the time for repeating the fitly chosen medicine is regulated by the greater or less rapidity of the course of the disease we have to combat, so that when necessary it should be repeated after 24, 16, 12, 8, 4 and even fewer hours if the medicine continues to prove beneficial without interruption, without producing new symptoms, but it is not sufficiently rapid in its action for the excessively quick and dangerous course of the acute disease. So that in cholera, the most speedily fatal disease, we know at the commencement of the disease 1 or 2 drops of a mild solution of camphor must be given every 5 minutes in order to procure speedy and certain relief, and in the more developed cholera, doses of cuprum, veratrum, phosphorus X frequently required to be given every 2 or 3 hours, and also arsenic carbovegetabilis at similar short intervals. In the treatment of so-called typhus fevers and other continued fevers, the repetition in smallest doses of the medicine that proves itself of service must be regulated by the above directions. In pure syphilitic diseases, I have generally found a single dose of metallic mercury X sufficient, and yet not infrequently 2 or 3 such doses were required given at intervals of 6 or 8 days when the slightest complications with soda were perceptible. In cases where some particular medicine is urgently indicated but where the patient is very excitable and weak, a more efficient and certain procedure than giving more substantial, though ever so small, doses of the highly potentized medicine in a single olfaction of a dry globule the size of a mustard seed that has been impregnated with the same medicine. This is effected by holding the mouth of the phial that contains it first in one, and then, if it is wished to give a stronger dose, in the other nostril, and making a momentary inspiration. The action of this medicine thus administered lasts just as long as that of the medicine that has been taken in substance. Hence, even this olfaction out not to be repeated at shorter intervals.